Join us now for Health for Life, brought to you by Vitruvian Health, formerly Hamilton Healthcare System. Today we're talking with Kendall Black of Hamilton Medical Center and Hamilton Diagnostic Center in Dalton. Thank you for joining us, Kendall.
Thank you for having me.
Well, Kendall Black is a senior CT technologist at Hamilton. Most of us are familiar with the term CT scan, but could you tell us what a CT scan is?
CT, or computer tomography, also known as CAT scan, combines X-ray images taken from different angles around the body, using computer processes to create an image or slice. Best way I can describe it is taking a loaf of bread. Each slice of bread is an image, a 360-degree image of that area.
I've heard that Hamilton has a new Revolution 256 CT scanner, which sounds pretty complicated. What are the advantages that one has as opposed to a regular one?
Well, first and foremost, the most important advantage would be speed.
Yeah.
The Revolution 256 allows for brain scans in 1 second, the ability to scan the entire heart in one beat, and allows entire body scans in 10 to 12 seconds. Another advantage of the Revolution would be the advanced image processing, which allows images to be viewed 2 to 3 times faster than the previous scanner, allowing for radiologists to make rapid and comprehensive assessments of the patient's condition, allowing for faster treatment plans.
Yeah, have you kind of seen throughout the years of working on this how the technology advancing?
Yeah, I've been doing this for almost 30 years now. When I first started, a normal CT of the brain took about 2.5 to 3 minutes, and that was for 12 slices or 12 images. Today, we're doing 100 to 125 images in 1 to 2 seconds.
Yeah.
So the technology has increased year by year, faster and faster.
Yeah, and so what are some of the advantages you could see from a cardiac scanning?
From the cardiac scan, for us, cardiac is becoming one of CT's most fastest growing areas within Hamilton. Cardiac scan allows for one heartbeat, high definition, motion-free scans at any heart rate, while using lower radiation doses and minimal breath holds. Even the most challenging patients with high heart rates, patients with rapid heart rates can have a diagnostic scan. It allows for comprehensive cardiac assessment of coronary arteries, myocardial perfusion, and heart function in a single exam. Also allows for rapid and precise TAVRs planning, which is a study performed for the aortic valve replacement surgery.
Well, this new CT scanner that you get, you've already kind of explained it a little bit, but it's just going to provide a lot more benefits to the department?
Yeah, a lot more benefits to the department and the community. It just allows to keep the patients here in our area.
Yeah, and that's just the kind of what happens as technology develops.
It is.
Yeah, that's great. And then what kind of neuroimaging would be available with this 256 CT scanner?
Well, neuroimaging is one of our most important areas.
Yeah.
Our C-spine and brain imaging are one of the most used procedures that we do. It allows for low-dose head scans in less than a second, which significantly reduces motion artifacts. We're allowed to do high-definition CT angiographies of the carotids and the vessels of the brain, rapid and comprehensive stroke assessments, all with the most advanced imaging reconstruction allowed for faster report times.
And then moving on to kind of the advantages of the more stuff it can do with body and, if I can say this one correctly, musculoskeletal?
Bones.
Okay.
Yeah. It allows for faster body scans. We use less radiation, we use less image contrast without losing image quality.
Okay.
It allows us for comprehensive CT angiography of the brain, the chest, the abdomen, pelvis, and even in the legs. We can look for pulmonary embolus. We can look for aortic dissections or aneurysms. We can look for calcium buildup in the legs. Also, it allows for high-definition bone imaging with significant reduction in artifact from patients who have metal or screws in their body. We use a metal reduction artifact protocol, which lightens out the metal and reduces streak artifact.
Wow. So kind of overall, just more advanced. Have you seen already the advantages of having just this very complicated imaging software?
Yeah, especially with the bone imaging with patients who've had orthopedic surgeries with the screws and the plates. The metal reduction software allows for it to just kind of blanket out and it makes it look clear. It doesn't get the streak, so you can actually see the bone. If there's fractures or developing fractures, you'll be able to see those.
Mm-hmm. So this makes it easier on everybody involved.
Makes it everybody. Easier diagnosis.
Yes. And so what are some of those safety features that the new scanner has?
Safety is important in CT because of radiation.
Yeah.
And the new scanner is equipped with integrated ACER, which is a dose reduction software which allows up to 80% dose reduction per scan on all age group of patients. Pediatrics, of course, is another area which we try to cut down the dose, so the faster scan times allow for less sedated free scans. Children are nervous, and when they're on the table, they want to move around. So the faster scan allows us not to have to sedate the patient. Minimal breath holds, which just makes it easier for the patient. And there's also what we call organ dose modulation, which the Revolution system can modulate the dose to critical organs such as the eyes, the heart, the thyroid. Just modulates the amount of dose that particular area receives. Faster scan time, less dose, just an easier experience for the patient.
Yeah, I kind of want to know, how did you kind of get into this field? I
got into this field right out of high school. Went right into the radiology program, which at the time was done at Hamilton Medical Center. We were actually in the hospital in radiology. And through that 2-year program, I received my associates in science in radiology from Dalton State and just went straight into CT from there. 30 years later, here I am.
The Dalton State's a great place to go.
It is a great program. Well, with this new scanner, the GE has created a better environment with design features such as soft ambient lighting. It's just a better patient experience. They've minimized the noise by using what they call whisper drive technology, which just makes for a quieter scan. It provides access and comfort to more patients with a wider 80-centimeter bore, which is the actual opening of the gantry where the patient actually goes in and out of. And just the radiation and then the contrast reductions just make for a better image quality.
Yeah, the radiation I think about, I never thought about the noise of the scan, how loud it might be.
Most older scanners ramp up like an airplane. It makes a lot of noise, and it can be unsettling to patients who are nervous.
Yeah, so you were also saying that the board themselves that they lay on is just a lot more comfortable.
The board is actually longer. It's padded. There's lighting inside and outside of the gantry. The new room is bright and just makes for a better patient experience.
So what kind of sets us apart from everybody else when it comes to this kind of stuff?
To me, Hamilton is highly technical. We have an advanced breast center, PCI. We have state-of-the-art MRI equipment. It's a good area to be in for our community to be able to stay home and to get the services they need and not have to travel out of town. Yeah. They can get the quality care that they need right here in our area.
Yeah, and that's perfect because, I always hear instances where people have to travel quite far to get, what they think they need when it's really all right here.
It's all in our hospital, especially with our new cardiac system. Patients can stay home. They can have their procedures done at the hospital. They can go home. It's an in and out. They can go home the same day they have their procedures done.
Yeah, so that only adds on to all the benefits you get.
It does, yes.
Well, hey, that sounds wonderful, and thank you so much for coming on our show, Kendall.
Thank you for having me.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.